I hope everyone can hear me. I hope everyone has their mute button pushed. If you're listening by a computer, I think the first thing we need to do is call the roll. Can everybody hear me? Commissioner Stubblefield?
Here.
Commissioner Spain? Commissioner Randy Wilson?
I'm here.
Thank you, Randy. Commissioner
That
Moore?
wasn't me, but I'm here. That wasn't me, but I'm here.
Oh, Frank, was that you?
Yes, that was me. Sorry.
Thank you, Commissioner Spain. Okay, Commissioner Wilson, I know you're on there, so you're here, and Commissioner Moore.
He hasn't called me yet.
Commissioner Meady's here, 4 present, and I declare that a quorum, and we'll start the meeting. I think the first thing we need to do is get the minutes from our last meeting, which, believe it or not, was February, entered into the minutes. I'd entertain a motion to accept the minutes and take as long as you like to read them.
Anybody got Commissioner Moore's cell phone number? Maybe text him?
I do.
I mean, I know that first week there was, last week at the end or something, there was people talking about, they thought it was at 4:30, some thought it was 5:30.
Yeah, she's clarified it.
Yeah.
Multiple times.
Yeah, I only heard 4:30 or 5, so we're at the last one.
In June.
I second the motion to adopt the minutes.
Say it again.
I sent her a text message, so
Okay.
maybe she'll answer me.
Very good. Maybe she can join us.
Yes, she said she's calling in now.
Frank made a motion.
Frank made a motion?
Yes, sir.
Thank you, Frank. Do I hear a second?
What was the motion?
The
Oh.
approved minutes.
I'll second it.
Thank you, Commissioner Stubblefield. Rather than our usual routine, I guess we need to take a vote. Commissioner Stubblefield,
Yes.
Commissioner Wilson,
Present.
yes, I'll take that as a yes. Commissioner Spain,
Yes.
I vote yes, so that's 4 and 1 absent. Russell, let's go right into your report like we always do.
You want to get EMA?
Oh, let's do the
Chase,
EMA
maybe a
report.
verbal report.
Yes, sir. How's it going? You all right?
Yes, sir.
Good. As far as call wise that we've had this past couple months, call volume has been down. We've been dealing mostly with a bunch of COVID-19 stuff as far as supplies given to nursing
Hey,
homes,
it's Stacy.
departments. And you got somebody calling in.
Yeah, I got it. Thank you very much.
But
Thank
we've been dealing mostly with COVID-19 stuff. That's why I do not have a typed up report as far as our call volumes, because we've been more concerned with the coronavirus than we have response.
Okay.
That's what I got.
Any questions for EMA?
Hey, I do. This is Stacy.
Hi, Stacy.
Hey. Okay, so I've been asked about EMA providing PPE equipment because apparently Sumner County's been providing PPE equipment for our office in Hendersonville. So my administrator up here wants to know about supply.
Is it going to be for the public?
No, this is for NHC home health. This is for our nurses.
Yeah, we've been providing for NHC. They received over 4,000 masks from us, and I can tell
No,
you.
this isn't the center. This is home care. This is at 506.
Oh, have they contact with the co-op? Not co-op. Coalition. That's what it is. Because they have to run through the coalition first, and then it comes through us.
Okay. No, can y'all send me that? Can you send me that link?
Yes, ma'am, I sure can.
Okay, that'd be great.
So they're gonna go in there and take them out?
Commissioner Moore, is that what you needed?
That's all I needed.
Thank you very much. We've been getting the report,
Mhm.
a motion for that report separate.
Yes, sir.
Yes.
I'd entertain a motion then to accept the emergency management report and the record.
I'll make the motion.
Thank you, Commissioner Stubblefield. I hear a second.
You look so pretty. I have a second.
Thank you very much. We'll vote by roll call. Commissioner Stubblefield,
Yes.
Commissioner Moore,
Yes.
Commissioner Wilson,
Yes.
Commissioner Spain.
Yes.
I vote yes, so the motion carries unanimously. Now we move into the EMS report.
All right, good afternoon. I brought you, March and April. You've seen them in your commission packets before, but we'll go over them, give you our point of view. We had 770 calls for service in the month of March 2020. Out of that, we transported 528 patients at the time of this report. So we had about 20 more calls for service, looks like. We did less transfers than we did in 2019. That's kind of when our COVID-19 was starting to ramp up, so we started seeing a big decrease in that because of the decrease in the hospital volumes. Anybody have any questions on that report? It's got our collections at the bottom. Rick will go over that in detail, the report there in a little bit.
I got one.
Yes, sir.
I know this is as of the end of March.
Mhm.
Well, okay, wait, let me get to the April report and I'll ask the question.
Okay. Go over to April. On the next page, we saw a pretty good decrease there. We went down to 651 calls per month. 443 of those we're going to bill out. So you see down below. Then I think it was like an 85 call difference, transport difference rather. So we really saw a sharp decrease there. Transfers were down to 37, and I think looking back over my historical data, that was the lowest we've done since I started keeping up with it a couple of years ago with the dispatch records. But all of our stations really took a hit on volume there. I don't think I've seen the Station 1 trucks do under 100 calls in a long time, really under 130 apiece. So we noticed the biggest decrease there. The other stations were kind of in line with what they always do. It was kind of odd. We had less calls at Springfield than we did at the other stations.
Now a question.
Yes, sir.
Now we're 18 days into May. Are you seeing an increase in the regular?
We've seen an increase in deaths. We've seen an increase in car accidents, overdoses, heart attacks. Just the things we weren't seeing are popping up now.
The things we weren't seeing before, yeah.
Yes, sir.
That's
Things that
that's-
seem to
that's
just
what my question
disappear
is.
almost overnight, they're coming back.
Okay.
Do people quit doing drugs?
I don't know, or they did something different, but maybe they weren't coming
Quit
in
driving.
to work.
They quit driving.
They
We
quit
definitely had a big,
So the NBCs are coming back.
also in the month of April, we received $61,818.91 from the federal government for COVID-19 stimulus. They based that on a portion of our Medicare revenue. And then we received $9,400 from Medicaid also. That's in addition
Okay.
to what's listed there.
And that's, you call it a reimbursement, but had we billed for it?
Well, that was the TennCare, part of the TennCare, where we pay in so much and then they pay back. So that's what that number's reflective of.
We should have some more.
And
of
if
that.
we get a refund, that means that we have more than our share of TennCare patients. Is I saying that right?
Yes.
Yeah. Okay.
Go to the next page. I'll let Josh talk about some COVID data he's been studying here.
All right, so I just compiled some rough COVID data of kind of how it's impacted our service. Like I said, our call volume has been down basically the last 90 days. So there's a month-by-month comparison with the historical months at the same time period. Basically, we're down about 165 911 calls for service versus this time last year. And then 58 interfacility transfers. So obviously, hospitals weren't doing their elective procedures and all that kind of stuff, and they were trying to hold on to as many people as possible. So a lot of that number's down.
Okay, Josh.
Yep.
I know I'm the only one that can't read this, but be sure, are we looking at, do we have last year's numbers that were?
Yep. So the shaded ones are last year's numbers.
Gotcha. Okay, now I get it.
Yep. So you got February, March, April.
Got it. Thank you.
I had it color coded, but
No, I get it now. It just took me a minute.
and so the next line down there is our COVID-19 calls for service. So those were broken down by the last basically 4 months since this pandemic started. So what we classify a COVID run is something where we suspected the patient had COVID based off their symptoms. They were a laboratory confirmed positive case, or they had some generic flu-like symptoms, and so they would qualify for testing. So March was definitely our busiest month. And then some of those patients in there also, we deployed out to Gallatin to help empty out that nursing home. They got hit pretty hard. So some of those numbers are in there as well. As far as the employee status there, so we ended up quarantining 10 employees at various times for various levels of exposure, whether it was an on-the-job exposure or one that happened while they were off duty. 4 ended up being tested, the testing sites, and all of them were tested, came back negative. So the ones that were not tested were just quarantined because they had an exposure. They didn't have any symptoms or anything like that, so it was just out of the abundance of caution. Quarantine.
Y'all transporting any from the Springfield assisted living?
The one that was just yes, ma'am.
Have they all been transported?
No, so right now the plan is to keep all the patients there, and they're quarantined inside their rooms, inside the facility. They've kind of separated the hallways. As of right now, I believe we've taken out 4 of them. One was a couple weeks ago, so that was the very first patient that we didn't feel had COVID, was experiencing symptoms. We actually transported for a possible stroke. Got to Northcrest, was being evaluated there, and I think 2 days later started showing symptoms. And then we transported another one that was positive here recently, and that's what triggered everybody to get tested. And since that, we've taken out 2. So we got 1 today and 1 yesterday.
Do they look like they're doing a good job of containing them?
I haven't been in there. That would be no from what I've been told.
Yeah, so there was a little bit of issues with that as far as the understanding of how they should do their evaluations on the front end. On conference calls, we reached out to them and they have weekly conference calls with all the nursing homes. So we are going to spend tomorrow, myself and CJ over at the hospital, going to help them out with some personal protective equipment and the screening process and stuff like that. Because we're treating right now, because they only, I think it's 20, is how many residents they have there. So we're treating the whole facility as positive. Just because there's only 20 and they've already got 13 positive. 5 of which were, there was also additional 5 employees that tested positive, and then they had 5 employees walk out on it. So we've been scratching around trying to help them find employees for the actual building. But now they're straight laced and they understand what to do and what not to do. I think they had some issues with some people trying to move out before the test results came back. I don't know how many was able to exit.
Very good. Any questions?
Thank you.
Any more comments? Okay, Russell.
All right, I finished my part with the fleet report. We've got 2 months of fleet information there, March and April. We had some module issues fixed on one of them, just maintenance things that would have been caught on inspection. We had one truck had to be towed in because the alternator broke off of it, so it obviously couldn't drive under its own power. Had an air conditioner that wasn't working, just routine maintenance things, tires. Total was $16,993 for 2 months worth, so felt pretty confident about that. We've got, I got one ambulance out of the shop this morning. I got another one in. I got an oil change, and it's out now. So I've got 3 reserves, and all of my frontline equipment is out on the road. We're in good shape. Got a couple more oil changes I'm gonna do this week, but other than that,
Let me ask you this, looking at the big picture, we're 10/12 through our budget year. Got 10 down and 2 months to go. How do we look on that? Do we have 2/10 left?
we'll be fine. We'll probably have to have at least one more set of tires on something, and probably 3 more oil changes. But barring something catastrophically failing, I don't see anything else that's going to.
Very good.
Starting to get, once it gets hot, we'll have some failures, but that's just part of life.
You tell us that every spring and
Yes, sir. Hasn't let me down yet.
spring and fall.
Hasn't let me down yet.
Okay.
Rick's reports are next.
Any questions for Russell? Anybody? Mr. Jensen?
Yes, sir. Well, I've got 3 reports, actually, February, March, and April, since we haven't met in a couple months. But then also I was gone on vacation when you guys had met once, so I included that one here as well. So starting off with February of 2020, we billed $445,018.80 on 563 billable encounters, which was up from $407.80.10 on 511 billables encounters last year. Our per call average went down $6 roughly to $790.44. Our collections for February were $204,396.35, which was up from $138,980.91 the year before. As far as the cumulative for this budget year, ending the month of February, we were at $1,532,896.63 compared to last year at $1,490,211.18. Our expenses for February were $393,640.23. And then our fiscal year-to-date expenses, $3,868,246.14, which brought our expense per call to $699.18. Anybody have any questions about February? All right, I'll move on to March. In March, we billed $392,674.90 on 513 billable encounters, and that was down from 606 billable encounters in 2019. Our average charge per call went down as well, $765.45. The collections for March were $209,408.10, up from $182,191.76 last year. And then our expenses, $406,982.72, and expense per call of $793.34. Once we get close to the budget renewing / budget talks, what I normally try to do is go what that looks like, but through 9 budget periods and then 10 budget periods. And as we get closer, so everybody has an idea. So at the bottom, you'll see there, through 9 periods, our budgeted revenue should have been $1,702,500. We were actually at the end of March at $1,742,304.73. So there was a positive variance there of $39,804.73 in revenue. On the expense side, our budgeted expense through 9 months was $4,325,061.75. Our actual was $4,275,228.86. So we were basically through 9 budget periods, we're under budget $49,832.89. So the combined net effect on the general fund is a positive $89,637.62. And again, that's through 9 budget periods. Any questions on that? Keep rolling. All right, so for April, we billed $486,352.80 on 604 billable encounters, and our average per call was $805.22. Our total collections were $265,866.96 compared to $205,323.62 last year. And like Russell said in his report, that's not inclusive of the COVID stimulus money and also the reimbursement from Medicaid or TennCare. So actually, we collected well over $300,000 for the month. But
None of that was in March. None of what you just mentioned was in March.
well, that was in March.
We're in April now.
Yeah, you're right, absolutely.
Okay, I'm just
No,
making sure we're
you're
not.
right. You're
COVID
absolutely
money was
right.
in
Yeah.
April.
Yeah, the COVID money was in April.
Right.
So we're actually for March, we were roughly 75,000 more than our number showed.
Okay.
So, yeah, you're right. Expenses were $319,445.99. So our average expense per call was $528.88. And again, now through 10 budget periods, our budgeted revenue was $1,891,667, and our actual revenue was $2,008,171.69. So $116,504.69 over our revenue budget. Now on the expense side, we had $4,805,624.17 budgeted expense, and our actuals are running at the end of April at $4,594,674.85. So there's $210,949.32 to the positive. So the net effect on the general fund after 10 budget periods is a positive $327,454.01.
Very good.
So that is through April.
And that 327,454.01 does or does not include the COVID and the refund on the Medicare?
That does not.
It does not.
Does
So
not.
that's in addition to
Correct.
this amount.
That's correct.
Yeah, because when we do that, we pay it in. It's a fixed cost.
Yeah.
But the counties that across the 95 in Tennessee that need it get some back. So you can see where you can get an idea of where we are in this big scheme of things.
Right. So, but it's not, we haven't gotten it yet? We haven't
No.
got it?
Oh, we have got it.
Yeah.
You got it, but
Yeah,
it's not
we-
included in
It's incremental. We get it a little along.
oh, okay.
So, we'll still get some more,
They
but
pay every quarter.
Yeah,
And the
it's a
COVID
quarterly.
is the COVID amount
It's a
included in this
one-time.
figure?
no.
Okay,
And that's a one-time.
yeah,
One-time
yeah, I
thing.
understand.
Yeah, the one thing, Commissioner Stubblefield, I figured out in about a decade is nobody cares how it looks. Everybody just does the cash. If it's in, it's in. If it's expense, no matter if it's a one-time deal or
Yeah.
every month.
Yeah, we originally budgeted where we paid in, like, I want to say, originally it was 75,000. And I can't, the next time, what was the
Is-
amount?
But what we pay in is a line item on our budget.
But it is a line item on the budget, so therefore, when we get the revenue back in, it reimburses us for that, plus some,
Okay,
so.
gotcha.
But you, just a sidebar, you all have already talked to Jody about the 21 budget already.
Yeah.
Yeah.
Jody's here. We
I
have
mean-
spoken to it about the revenue piece, and we decided just to keep it flat for this next year on the revenue side. So we'll still be billing $2,270,000 flat over this last year. We're looking good where we are. But again, as far as the environment of healthcare and what's going on and everything that contributes to that, we feel like that minimally flat would be prudent. Even though we've had year-over-year revenue growth, we just want to make sure that we're not overstepping what we feel like we're going to be able to collect.
Okay. Anything else?
Nope. That's,
Any questions for Rick on his part? Any comments?
Looks good.
Coming from a member of the Budget Committee, I'm glad you noticed that, Commissioner Stubblefield.
Looks good.
I entertain a motion then to get the report into the record.
So,
Commissioner Stubblefield, thank you for the motion. Do I hear a second?
Second.
Thank you, Frank. All those in favor then signify by saying aye. I'm going to call the roll. Commissioner Moore, that's good. We got your vote. Commissioner Stubblefield?
aye.
Commissioner Spain?
Aye.
Commissioner Wilson?
Aye.
Did I get everybody?
Yep, just you.
I vote yes, so the motion carries unanimously. Thank you all very much. That's a good report, and that is just like we laid it out a few years ago for us to know every month. Even on top of that, it's nice when everything is plus, as opposed to the other way, right? Because we've seen it both ways. What's next?
Oh, I've got, I don't have anything specific. Josh covered the COVID stuff, Russell's reports.
Very good. Commissioner Doris had asked to speak to the committee, and Commissioner Doris, I'll give you the floor.
All right. Hey, look, I've talked to Mr. Rick and you both about some questions that we have concerns with about different people outside in Robertson County. One of my main questions is, I know you said something about y'all had taken comp time and where it goes to straight time if somebody uses it. My understanding is if you use vacation or sick time and take a day of vacation or sick, and you're not even there, you still get a full check with overtime without being there. And can y'all answer that question for me?
I think you know the answer to that question.
Well,
I don't know why you're asking it. Your wife works there. You know the answer.
No, I don't talk to my wife for us. And that's, I'm gonna tell y'all, y'all can laugh what you want, but me and my wife have a relationship, and that's the only way we can get along without me.
That's the only way that it's been ever, and yes. So the EMS employee's salary is based on overtime.
So,
and when an employee takes sick time and they take vacation time, they're paid
overtime for not even being there.
That's right.
Working overtime. I understand it. Now, when I talk to Mr. Eden,
that is a benefit.
It's going to be correct.
The comp time was correct.
Correct. And Mr. Jensen said that was done.
Right.
But when I talked to Mr. Eden, he said that he thought that all of it was,
Well,
because we're paying overtime. I mean, if I can not be there, why would I not call out? Why would I not call out and get overtime paid for? Basically, is what I'm saying.
Well, you have to have the time built up, one thing. Not everybody has that much time built up.
And that's
some
true.
employees have more than others. Some don't have any.
That's true. But one reason they're not gonna have it is because I'm gonna get overtime for not being there. But I'm going back to just the money in the budget, $5-point-something million budget. We're looking at paying people for overtime rate to not even be there is what I'm
I can
saying.
tell you this, Bubba, and to Russell's point, EMS has calculated their overtime this way for ever. And we've not changed that. What we did look at is, okay, if we go ahead and make that change, what is the impact on the budget? But then also, what's going to be the impact on the overtime? Because I can tell you this, you're not going to save money because you're going to have open positions. Because if we go back and we tell EMS employees that that's not the case, and this is 2 or 3, 4 years back or whatever, you're going to have an exodus to the point where the people that are there, you are going to be paying overtime, whether you've got open positions, so, you're having to keep trucks open in the county, or, you continue down this path. So, based on that, it's kind of, that's the way the county wanted to do it. All they needed to do, and they need to do, is tell us that, we'll initiate that, but then look at what the downstream effects are going to
I
be of that.
understand, but how can we look at people that pays the taxes and tell them we're paying them overtime for being there? Plus, they can take, because when somebody takes off, you're gonna more likely pay overtime for that spot to be filled. Some way, form, or fashion.
Usually, yes.
So you're
you're
gonna pay,
right.
well, now we're paying double overtime for that
There we're
spot.
paying a part-time
We're
person.
paying a part-time.
All part-time.
That's the-
I know what's
design.
ideal.
And,
but
and that's
it don't
what we're
work
trying
out
to
all the
do
time.
is,
It doesn't always work like that.
Well, I've
But
worked
again-
there and I know it don't work that well.
not all the time it does.
But technically, we're paying double time for that slot because somebody's getting overtime for not being there. And plus, we're paying I'm gonna say a full timer, double time for being, a part time and half being there also. So now we're paying double time, overtime twice, rather.
So the net budget effect of that, if you,
I
cut that
understand what you're saying.
completely out. So,
And I understand what you're saying, but I'm telling you, if I could make the same check with overtime and not have to go to work, my lazy self would probably not go to work and make the overtime.
Well, if you don't
your
go to
plan-
work, you either gotta be sick or you gotta have comp time, right?
Well, you
I
have,
don't know. I don't
vacation
do-
has to be
No, of
requested.
course.
I mean,
You're
it's
allowed to take
technically,
comp
yeah.
time and vacation time.
Yeah, but like, you're supposed to have one or the other, I'm assuming.
Well, you don't have that, I mean, you can
But
burn
see-
it plumb out.
You can burn it
But-
plumb out.
But,
then
when you get to
Yeah,
the point where
you're-
you're not gonna get anything
Yeah,
when you
your
burned
plan-
all your time.
plan only
We'd be
works to
better
a
off-
point.
Well, would not be better off though to make it look better to raise their pay than to charge them, pay them overtime for not being there though?
listen, I'm all, if that's
I mean-
what the county commission decides to do and they want to raise the budget to reflect that, then you know what? I'm all for that, because at that point, that becomes a real easy
But I mean,
sell when you're trying to recruit
I
somebody.
think if you do,
we would
If
technically
you take a
move it from
benefit away
overtime
from
to
somebody,
regular pay, right?
I don't believe in taking a benefit that's been long-standing away from people that aren't getting hardly any benefits as it is. An ambulance employee earns the exact same sick and vacation time that a regular county employee, that Chet, anyone in this room, Jody, whoever gets. Although they still work 24-hour shifts, they only get 8 hours of sick. It takes them 3 months to build up a sick day. It takes them until it's 8 hours of vacation until 3 years, then 10, then 12, then 14. So until you've been here, over 9 years, you're not getting 14 hours a month of vacation. So it takes,
And I don't disagree. I mean, that's why
It
I
takes
think comp time, and that's just me.
comp time is never paid in overtime. It's only paid in straight.
That's right, and it's,
Holiday pay is only paid in straight.
but if a person starts new, they ain't got no time, that's when we should allow them to make comp time. If once they've been there and it's sure established time by now, the comp time.
Yeah, comp time can begin immediately on day
Because-
one. You have to work a month to get sick and vacation time.
Correct. And-
So my concern is the amount of people that we would lose by if you take away that benefit and you don't replace it with something.
Well, and don't get me wrong, when I say this, I'm saying,
I'm in a better spot than I've ever been with employees. I have one vacancy.
and I'm very off for it, but when I look at these people that I'm trying to help oversee the money for the county, paying somebody time and a half for not being there, I wouldn't want to do it.
You can figure out,
Even if it come to raising their salary to offset, but they'd have to be there,
You know what?
take it from overtime, put it back to regular time, is what I'm talking about, you know what I'm saying? But showing.
I'd love to give them all, 24 hours of pay period. Like everybody else, everybody else gets a day every month. So not a pay period, I'd like to give them 24 hours a month, but at the same time, where does that end? There's a cap on vacation now, you're capped at 240 and then it rolls into your sick. Well, if you take off on sick, if you're off more than a shift, I'm going to ask you for a note. So, if you.
Ain't nothing wrong with that, but y'all know what I do on the EMS side, you can ask for it, but it ain't nothing to get a note, so, and I ain't trying to throw it out there, it ain't nothing to get a note. but it's worse, at
I
least
don't
he's
feel
making
like
them
I
do
have
something,
a
at least he's making them do
significant
something
issue
to
with
do it.
Wait, one at a
abuse right
time.
now.
You go.
I don't feel like we've got a significant abuse with the sick time right now. Vacation has to be in advance, though. People have to request that in advance.
So,
Now, in the past, have we? Oh, yeah. We've had some abuse.
and I asked for 2019, 'cause that's just a year that we've completed. I asked for the information, so I've asked, for, I reckon, well, that was Ron's too, on time sheets. I don't know if y'all got the question.
I got a copy of it.
Okay. So on time sheets, you can go back and, look at a time sheet. I'm assuming if they're still done like it used to be. You can go back and look at a time sheet and you can tell if somebody was there or not because they used vacation or sick time or whatever put in that slot. Does that make sense? So you would be able to go back and count the amount of time sheets that people got full pay, and you would be able to come up with some kind of idea of how much money we're talking about that way too.
Well, we wouldn't even have to do that, and I'll tell you why. At the end of, like, June, we turned in the spreadsheets to the finance that showed how much they accrued, how much they used, and the ending balance. So that would be you just have to know the hourly rate.
You just need to know the difference of the days they took though, because they're gonna get.
Well, it's separated vacation, sick, and comp. So you just have to have the rate, and then you could figure out.
But what I'm asking though is
And now not every
to
sick
look at
day
this
is,
for me about paying time and a half. If you need to look at as a committee, if you can ask about or see about maybe taking it from time and a half rate when they're there or not there, or when they're there to make it a little bit more, maybe eyeballing and appealing for people to come to us, make a little bit more on our than to pay them time if they're not there, is what I'm saying. Because, and I hope I'm saying that clear as mud so everybody can understand me on that, so I'm trying to get answers to these people.
Let me make an observation.
Yes.
And I can go back 10 years.
Okay.
And I've been a part of this conversation under a couple of it, administrators, the bosses in the EMS department. And there's no doubt we're a little bit addicted to overtime. But it's been proven to me that paying overtime is not the worst thing that we could do, because the other side of that is to replace it with a full-time employee, which brings on, can you find the employee? And if you can you find a slot for him and all that? So having been at this very spot, I know 2 or 3 times. I think every one of them was with the previous mayor. We concluded, I can remember Chairman Baggett agreeing with this, that we concluded that paying overtime in the EMS department, the way that we calculate their overtime when a day is 24 hours, wasn't the worst thing that we could do. That makes sense?
Yes, sir. And I'm not disagreeing with you on whatsoever, except for getting overtime for not being there, taking the space, taking the call, being there to do your work and go home in the morning when it's your turn or whatever.
Yeah, I hear you.
You know what, and here's something I'll offer. We can see what other agencies do. We've got resources. I know there are a lot of agencies that do what we do, but I don't know what other places do that, I know how Cheatham County works. I know how some of the others work, but I can't speak for all of them. So, it's hard to compare us to exactly someone else, but it's worth it, ask.
Go ahead, ma'am.
When I first got on the EMS committee, I had some questions about the overtime, and I think Russell and I have had some discussions about it, but I spent some time talking to EMS employees. I talked to people in other counties at that time. I did a study.
You sure did.
And I talked to the EMS guy down in Murray County, And they do it the same way we do. But I'm in agreement to where I think that this is not the worst thing we could do. That it may not be the most ideal way to do the pay, but when you look at it, the citizens of this county are asking these people, these men and women, to give 24 hours of their life at a time, away from their families, away from their beds, away from their responsibilities at home. And I honestly don't think that the overtime is an issue when we're asking these people to take their, and I know that's a heartstring thing to me maybe, but when we're asking these people to give their lives to us and take it away from their families, that it's not that big of an issue, and I personally think we ought to leave it alone.
Do you agree that we need to pay them overtime or time and a half for not being there to do their job? Is that what you're saying?
Absolutely.
Okay, so I just want to make sure I'm clear of what I'm being told.
It's really their time anyway, Ms. Fay. Like you said, it's their time. They built it up.
Yeah.
All right.
Thank you, Randy.
Uh-oh.
I kind of agree.
Can I ask a question?
Yes.
Did the individuals that were in question, were they hired based on getting paid for overtime? Is that part of their contract?
It's part of their calculation for their annual salary.
Okay.
Yes.
Yeah,
And then if
let me
they
say,
have-
we don't have a contract. Everybody that works for the county works
I'm
at
using
will.
a figurative term, okay?
Yeah.
But when you're negotiation with that employee, this is what you said you would pay.
It is the pay structure that's
That's
laid
how
in
the
Friday.
pay structure is.
Correct.
Now, it sounds like we're saving money when they do have holiday pay and they have other vacation pays to go back to regular time. I mean, you could hire that individual for full staff for that time and a half, which will only be normal time. That's the deal that you cut with these employees. I don't see anything wrong with that if that's the way you structured it. But now don't change it in the middle of the stream.
Right.
And if you categorize some as being different than others, that's what we can do. We have to be in government, have to follow some kind of legalities there. But if that's the arrangement that you've made the employee, Mr.
Right.
Bubba, I don't see any problem here with that structure. And I know where you're coming from because it looks like they're getting double money for staying at home.
Well,
But that's why they were hired.
Well, I'm looking at, we're paying overtime twice for that slot when they're not there, is what I'm looking at. That's what I'm trying to get an answer for. And y'all can correct me if I'm wrong, but if I call out today and it's on the last pay period and I call out for a sick day, I'm still gonna get a full check. It may not be, or vacation, but I'm still gonna get a full check and not be there. Now they're gonna pay somebody to fill in. Hope, regardless if it's a full timer, they're gonna pay them time and a half again. So now that day's getting paid twice.
Let me make a comment. Did you hear what I said?
I heard what you
The
said.
other side of that is to hire additional full-time employees to have them there all the time, so everybody works 37 hours a week.
And I'm not a part. I understand what you're saying, and I'm not a part of it. I'm just trying to answer the people asking me these questions, sir.
I actually did, when I did my study, one of the things that I did was because I talked to several of the paramedics and to Russell about hiring more people and doing 8-hour shifts.
Sure.
And that would cut out all the overtime. But in the long run, that costs us a lot more. Not on top of the fact that we would have to hire new employees and lose employees because they're living off of overtime. But it would cost us so much more money in the long run to hire more employees and not pay overtime.
To change our hourly structure, we'd have to hire another shift of people,
Right.
at least.
And then you would have to hire more than that because you're going to lose a bunch
Right.
from that.
And you'd have to increase your.
Dennis wants to.
He's mentioned a couple times that we're paying for that same hour that employee calls out and is gone. We're paying 2 people, time and a half or double time.
Time and a half.
Okay, time and a half. So you got, if it's $10 an hour, we're paying $30 for that hour, right?
Correct. That's what it would be.
Time and a half. $10 would be 15. We're paying $30 for the hour. That does seem a little bit, but it sounds like the only way to get around it is we've got to increase the staff. How many are we down right now in the EMS that we need?
Just one.
I heard 5 from somebody. I guess that's
very
Well,
inaccurate.
How long have you been at 1?
2 months maybe.
Okay.
Yeah, I mean, before that, we were only down 2.
Yeah, we haven't had the loss of people problems that other services have. Like Montgomery, somebody told me he was down 20 employees.
Yeah.
Rutherford is nothing for them to be down 15. It's just.
Well, I'm just curious, why would we not go on and hire a few more and put them on and cut that $30 an hour back down to $15 an hour? And put a few more people on the payroll that can be called in when you need it, that are not gonna run us into the double.
We have part-time employees, but, and they make, a part-time, paramedic makes probably, $14, $15 an hour.
Okay.
Part-time EMT may make 13. So
Sure.
if we either have to attract, we don't get a lot of applicants because everybody's working private services,
Sure.
like St. Thomas, place like that, they pay a lot more an hour than we're paying the part-timers. So it would either cost us a lot more, and we cap our part-timers, we don't pay them any overtime generally. Occasionally we'll have to pay a little bit, but not very much. So we usually cut them at 36 or 40 hours.
What's the total staff of EMS right now?
55 counties. And, so on the ambulance, it's about 50 on the ambulance.
Okay.
No,
And we probably have about 10, 12 part-time people. They're just kind of irregularly work. Some of them work more than others.
Commissioner Darce and you, Commissioner Wade, can see very clearly what that line item is on the budget, because it's a line item for overtime. It's built right in up front.
I know, and I'm aware that overtime is a part of the way to get these guys to do the job. And 24-hour shifts, that's a big part of how they plan their lives. Working 24 hours over here, and you go over to this county and work another 24 hours.
We definitely have that, yeah.
Yes, it happens all the time. Guys I knew that worked in both counties.
I did it for a long time.
Yep. So, okay, I'm understanding.
Okay, thank you.
But it's the way that.
Yes. Yep.
The $10 deal that you're talking about, we got to get off the fact that we're paying them $30. It's in the agreement that that person has a right to take vacation.
That's part of his benefits.
They earn
As
it.
part of his earned package, but we have to replace them, and that's part of the deal going in, that we replace him, whether at regular time or time and a half.
Okay,
We'll get past that $30 total.
I will not go past it, because the only thing that we as commissioners are responsible for is making sure that we do a good job of managing the money that is
And we
given us by
are
the
doing a
taxpayers.
good job managing it.
And I don't disagree with you completely on that at all. I'm asking questions so I can better understand. I've asked a question to CTES. I've told the chairman, I've asked a question to CTES to tell me what our comparison is on counties of equal size. What are they paying per day for a truck and a crew? So I want to be able to compare us to all the other counties across the state that have got a similar size county.
That's where we disagree, because I don't want the comparisons.
Why?
I think we stand on our own 2 feet.
You don't have to recreate the wheel.
Don't.
You don't have to recreate the wheel.
I understand.
Let's look and see, and if there's something we can learn from another county. That's all I'm asking.
But let it fall and let us do what we're supposed to do with the monies we have to do with it. And we're doing a good job with it.
And I don't disagree. I saw it a lot worse than some of y'all saw it.
I've been there.
10 years ago, 20 years ago, when I was out on the county commission.
Well, let me just say this, at the end of the day, I know what Bubba's saying, and I know what, just listen to everybody, but at the end of the day, you've hired us to manage as best we can. Do we have a sick time abuse problem? No, I wouldn't say we do. So is it inefficient at times? Yes, but that burns itself out, because they can only play that game that you're describing so long, because when they run out of sick time or whatever, there's none of that. But again, if we had more of a sick time problem, I would say that your scenario would be more broad than it is, because really, I think we're really talking about a smaller amount, because when you use sick time, we can go back and look at how many sick time hours are used. And then we could even go back through EMS manager and see who actually, worked the shift to see what was the financial impact of that. But as far as having an overarching broad problem with the way we compensate, I don't see it. And again, to the point, I mean, other counties, there's a lot that do it this way. I'm sure there's some that do it completely different. And if there's a better way, I think as a county, we need to adopt that and say, okay, we want to move in that direction. And if we do that, then that's fine. But understand, to Mr. Hogan's point, we've come into agreement with our current employees that this is the way it's done. We'll lose a lot if we do that. And you know what? Collateral damage, I mean, it happens if we're making a fundamental change when it comes to the way that they're compensated, because you can mess with two things and get people ticked off.
That's right.
Their money and their schedule.
Right.
So, at the end of the day, if that's something that the commission would like for us to do and the EMS committee would like for us to do, we'll be happy to do that, Bubba. But to think that there's a big pot of gold at the end, no matter what scenario we adopt, there's not a big pot of gold out there. I've looked at it, and I'll be happy to recreate it and do it.
And how much you can take it, you can take the amount of people that you have versus the hours that you, and you can come up with a number real quick. Sure. You got it there in front of you.
Sure.
To find out exactly how much we're spending out on people, we're paying for empty space, I'm gonna call it, for somebody not being there because it's a part of their package.
Yeah, I mean,
well, Mr. Norris, it's in the budget right up front. It's in the budget. All you got to do is look at it.
We're gonna pay them half time to not be there.
Yeah, I mean,
every employee,
our overtime
based on 848 hours.
We schedule that in our budget before we ever start.
Yep.
You've read the budget. You've got one line item there for overtime.
One thing I'll say, y'all, we've got some really good employees. I mean, great people. And
I agree with you.
Out of all 51 ambulance employees, they could all go out tomorrow morning and have a job. Every single one of them.
Well,
they wouldn't be starving anywhere. I mean, and some of them could go and make more money. I mean, some of them couldn't. I've got some, 30, 25, 20, 18-year employees. They could go anywhere and get another job tomorrow. If we, and I'm not saying, let's not upset the apple cart and make somebody mad. You can do what you want to do, but they're good employees and somebody else will pick them up.
Well, that's exactly right. And, we've made a concerted effort over the last however many years to increase the knowledge level and the competence of our medics. And we've, invested in critical care programs. And now, we've got the biggest percentage of critical care medics that we've ever had at the service. We won Service of the Year for our protocols last year in the state of Tennessee. So there's so much that we've got invested there that to change it and lose what we've truly built from a compensation model, I mean, again, if the county commission wants to do that, then we will explore it. But at the same time,
I think you've got somebody who wants to.
No, I just want to say, I don't want y'all to think I want to upset the apple cart and throw everything away. I just have questions, and I have had people stop me. I got my ear ringed out the other day about an employee that has left. And I'd like to talk to y'all individually maybe about that later.
Please do. Please do, because we get a little of that ear ringing ourselves.
Yeah, and I just want to know and get y'all's input on it.
Sure. Be happy to anytime.
Okay, we'll talk after this.
All right. Now, when you said that, it made me throw my train of thought out of the way. I want to go on past the overtime if it's okay with y'all, since I've thrown it out there and got y'all's response.
Please just go to the next.
The North Crest cops. And I was looking, I know that I asked for a 2019 summary of how many calls you had in removing from North Crest versus going into North Crest.
That's 19, and the next page is 20.
Okay. Now is this
this is called from hospital to hospital. This doesn't include discharge. That's going from North Crest to
another hospital,
a Nashville hospital.
Well, okay, so it doesn't
discharge. We can figure a different way. This is the.
So we got, and that's, and when we add these totals up for the year, what is it, 916 total?
Yeah.
And say this doesn't include the, like, hospital going.
Nursing home,
nursing
or back
home.
home, or
How
home.
many of them you estimate, Russ, or Rick, or whoever, sir?
Right, 5 a weekday would be mine, I don't know, what do you
Yeah.
think, about 5 a weekday,
I
so.
mean, we can pull those numbers.
The numbers are, I can tell you the numbers are pretty close to our transfer rate. It's, as far as interfacility.
It depends on the day, Bubba, you know, one day you might have nothing, the next day you might have 10.
So.
Pretty strong from last year, though.
On these transfers, some of the concerns is they want to know, y'all pushed and y'all gotten ambulances and gotten more ambulances and personnel. Cause back when I started, there was 3 ambulances total. But, now you what, 7 trucks now, maybe? 8 trucks now.
What year did you start, though?
Hasn't been a while back. But the 8 trucks we have now, a lot of times, the people that, are telling me that, they're coming to me telling me that they go by, stop by, one of them had a Cedar Hill Station. One of them had a small child that they thought they was choking or something. Anyway, they pulled in there, but the truck was gone, and lo and behold, it was supposedly gone to a transfer from the Nashville out of county instead of being here ready to prepare 911 for its own county people. So.
And Commissioner Darcy, the person drove there with a child or drove there to get
They
there?
live there
Instead of calling, they drove to get it.
because they live like 2 houses, 3 houses down, so they drove there instead of trying to make the 911, because y'all know how long it takes 911 to go through the system sometimes. It takes 2 or 3 minutes before it even gets toned out, so they drove there, and there was no one there. I reckon, I don't know where they found their information out, but anyway,
Is this current?
this is
This month, last month?
2 months ago, probably. What month is it? 2
Do
months.
y'all know about this?
2 months ago.
Nobody's ever contacted me.
I've not, and I know that the trucks are out doing transfers because it's right there in the numbers right there. Now, when we go to work, and to me, and I hate to say it this way, coming from the ambulance side, to me, our job is to take care of the residents, to get them to help. I'm not saying transferring them because they can't. I mean, as y'all can see, I was in the hospital this past week, and they was going to transfer me out instead of attending to it. I ain't gonna lie to you, and at the time, they didn't know what to do with me, but anyway, make a long story short, and this just happened this past week. So, and I told him, I told the doc in the ER, I'd like to stay in my own county if I can, because they was gonna transfer me to Skyline.
This was the emergency room at Northwest.
Emergency room. So, and I went in there with I had short of breath symptoms, but it was just a matter of they put up with me for about an hour and a half, and then they was ready to ship me off to Skyline.
Okay, I'm glad you're okay, but make your point. Your point is you didn't want to get.
To me, we took ambulances out of the county. I refused to go. So that would have been another call we could have took out, and there might have been a child that time that didn't get unchoked.
So
Yeah.
let me speak to that just a little bit. We are a good partner with Northcrest. We try to take care of, take everything we can there. And if they do have a request for us to transfer to another facility, we try to do that. We tell the captains all the time, if you have trucks out of the county already, well, your resource, you demand that you have going right now, tell them it's going to be 3 hours, 2 hours, or whatever. You control that because they're in a controlled environment over there so that we can continue 911 service in a way that is the best thing for our citizens in the county. when, also, whenever we do have a truck that we pull, and we kind of rotate our transfers a lot, when we do have a truck that's, call it Cedar Hill, that's transferring a patient, we do, edge zone coverage so that if there's anything in that zone, we can cover that. They may not be parked right there at the EMS building,
We cover White House.
Yeah, but we do White House when we have backup there, when we transfer a patient out or they go somewhere.
The further areas, White House and Cross Plains, who we cover more.
So, those two, we do that cross-zone coverage like that. And we'll send a truck all the way over to Crossroads going towards White House to sit there. And if there's a call, then boom, they take it. So we do cover. Now, was there a truck sitting at that facility? It does not surprise me in the least that we didn't have a truck sitting there. If the other truck, the main truck, was on transfer. But from a 911 service standpoint, when they call 911, we still maintain zone coverage regardless of our transfers. Now, there are situations when if it's not managed properly and you've got 2 or 3 trucks out of county, then you do put yourself in a pinch. But that's an educational thing with the captains, and when we encounter that, we bring that to their attention for resource deployment. So,
Let me ask this question, sir. Would we not be better off, since we pushed to get the trucks and the people, would not be better off to keep them in our county for our people in our stations in case something like it comes about? Because like you said, the ones at the hospital was in a safe,
controlled environment.
They can get and let me ask you, what does most counties around us do? Most counties hire private service.
Well, I wouldn't say most. I would say some do.
Okay,
Montgomery County
some.
does. Montgomery County, if it's a non-emergent transfer to Nashville, then they have a private service that comes and picks them up at the hospital.
Sumner does their own. Cheatham does emergency still, I think. Montgomery has farmed out a lot of stuff except emergency.
And it's changing. I know it's changing. And this 2020 stuff, ain't no telling what's going to happen. But I just wish I would look at.
I'll tell you about. I'll give you this is the street person. The paramedics. Perception transfer. If I went in there tomorrow and said, y'all, we're not ever doing another transfer again, discharge, we're done with it. There would be like a party in the streets. I mean, it'd look like Mardi Gras. They'd be screaming, hollering. But the 2 things that would happen is we would lose some money. There's a sheet here that probably tells us the estimation of how much. I mean, it could be $700,000 a year. I don't know. It just depends on the payer mix. But the patients there at the hospital, they would wait longer. The critical ones would definitely wait longer, and they'd be attended by, somebody from somewhere else. So it would either be a private ambulance, or it would be somebody, whoever they contract with, have to be private. But there'd be a difference in the level of care that would be. It may be a paramedic, but it wouldn't be one of mine.
But here, let me say this. We deploy on every shift a certain amount of fixed cost. Our trucks are out there. Our crews are out there. The machine goes around and has a certain amount of fixed cost associated with it. When we take a transfer, what we're doing is spreading that fixed cost out over a number of more months. So, it's incremental income that if we set in the station and only put people to the hospital, then our run numbers would go down. Our transfer numbers would go down. Our cost at this point wouldn't go down because of the fact that we've deployed those. Now, if you're saying you want to retract and drop 2 trucks because all of a sudden, our convalescent truck that we had in Springfield, we moved it to a 911 truck. So if we had a day truck and that's all they did, you could drop 2 trucks or whatever, based on the number of transfers. But in our current environment, there's not any way to have it look financially sound for us to drop the transfers and interfacility transfers because it's going to make our cost per run go skyrocket. Does that make sense?
No, and that cost would really help, because is it going to cost us $300,000 or is it going to cost us? If we turn down the calls, do you have
I guess the thing people always told me was 911 didn't pay your bills because, you never knew what you were going to get based on who you picked up. And
We do our best to try to have them pre-certed, so we know going in, and Tina can, speak to that. I mean, it's back and forth with Northcrest for medical necessities and different things that we need to have the claim adjudicated as we
Working it out.
But in this, what that number looks like, I don't have the exact number that would, cash-wise impact us. But at the same time.
If we took could you don't have a number, if we took Northcrest Plum out of the picture, then transferring their costs, you don't have any type of number of what it would cost us, that we could save?
Well, I mean, right there, 16 calls, right there.
Hey,
That's
it's
0.5.
This is Stacy Moore.
Runs a day.
Hey, I don't see that taking the transfers out is beneficial to anybody, because Northcrest cannot be everything to everybody. So they have to go to those specialty hospitals such as Vanderbilt, etc. So taking a taxpayer money and not I don't see that happening.
Well, and,
there's other ways to do it, Tracy. There can still be an ambulance there and not cost the taxpayers.
But they don't come. They come at their convenience. They don't come running with a siren on when these private ambulances.
They sure don't.
And they'll get there when they take a notion to get there. And their first priority is money. Our first priority is not money. It's the citizen of this county.
Correct.
And the care that they get is totally different from what they'll get on one of these private ambulances, because private ambulances are in business to make a profit. The EMS is there in business to take care of the citizens of this county. And if I had to go from Northcrest to Nashville, I would want a EMS from Robertson County to take you as opposed to a private. Because they're just holes of trucks, as far as I'm concerned.
That's
Okay,
right.
Very well.
Exactly.
The point is, you think that,
By looking at the amount of money we could save from not running Northcrest calls, how much it would save the taxpayer in this $5 million budget?
we don't know.
I think
We don't know that.
somebody
We'd have to estimate a lot of, because you don't know what kind of, if they had insurance, if they didn't have insurance.
And that's the reason I asked for like 2019 stuff. It's in the past. Does that make sense? So.
The other thing that, and this isn't us, but there's a burden there that's going to fall on somebody, whether it's the patient or whether it's the hospital, when you have someone that, has to go somewhere else, where, we'll come and take them and try to get them where they need to go, and try to worry about the, collecting from them later. The other agencies are not going to do that. They're going to want cash up front, pretty much, purchase order, something like that, or.
We have ResMed, I think it's the name of the company. Is it ResMed? That's the ambulance. They transported my mother from Skyline Hospital 1.5 miles down and charged her $1,200.
Pretty steep.
$1,200
about $11
to take
a
her
mile.
1.5 miles.
Commissioner Stubblefield, did you question that bill when it come through?
I did.
There you go.
Well, that's just what it costs.
And we also try to work with, if there's a patient that can go another way, if they can go by car, we try to, urge that, because a lot of this, we know their insurance, up front, Tina knows, Carrie knows it's not going to pay for X, Y, Z. And the nurses at the hospital and the doctors, they don't always know that, because it's not their specialty. But
let me say this, for the sake of time, your point is noted.
Thank you very much.
You got another one?
Yes, sir. This is from kind of from one of y'all's ex EMS committee members. Does EMS have any undercover cars in the county?
Dear God.
wow.
Does we have any unmarked cars in the?
So let's just cut through it, Bubba. You're talking about Russell's car.
Okay.
It's silver, it's got a government tag, and it's got a license plate on the front.
This county.
I'll make it look like one of the sheriff's cars.
Man, for $100, we can stick a sticker on the side of it.
We dealt with that. We dealt with that years ago.
Y'all know who it is.
Exactly. So if that's something the county would like for us to do,
would y'all mind spending $100 to put a sticker on it then?
It costs more than $100.
Why?
Well, I mean,
I don't mind doing it.
It's got government tax on it.
It doesn't
It's all
say
got
Robertson County government tag.
It's got full lights, it's everything, sorry.
It says.
If it'll make you feel better, I'll be glad to do it.
Well, I just think we need to make the police department put
Yeah.
tag Robertson County sticker on all their
I mean,
undercover
I see
cars
sheriff's
too.
deputies dropping their kids off
Sure.
at school in unmarked vehicles all the time, so I think that's interesting.
Yeah, but we did have that issue before
We did.
with
It's
EMA.
been a few years back.
If
On the
that'll,
EMA, we had them put them on the truck.
On the EMA, we did.
That has blue lights also. But I don't mind,
Russell.
if you think
It's a
that,
magnet.
if it'll make the people that's bothering you, I'll be glad to take it over to Dynamics and let them.
No, in his defense, I think it's a little more than that because we decided before we needed to identify our vehicles.
I don't mind at all.
Yeah, that's nice.
That's not, and I'll tell you, all that car, when we bought it, it had 22,000 miles on it. We bought it used from the sale of surplus property. It's got about 61,000 on it right now. That's an average of about 600 miles a month. Every mile that car has on it is accounted for. Its whereabouts are accounted for all the time. It is used for official business only. If it's not being driven by me, it's either in the parking lot at the station or it's at my house in my garage. And
And are you out spying?
And Bubba, to your next question, GPS is on every vehicle we have except the mule.
You ain't gonna put it on here?
if I could figure out a way to do it, I would.
Yeah.
Alright, so GPS on there, okay. With our, in our reality, y'all, I've been sitting there with y'all for over an hour. Can I be satisfied with these questions for right now and come back at maybe at a later time and ask y'all if anything else?
Come to me, sure.
Alright. And I don't do this to make anybody ill.
Well, there's one more thing that I want to cover to get out of the
Sure.
way, simply because you brought it up to me on the phone the other day.
Okay.
And that is workers' comp.
Okay.
So we had an employee that was out, and we allowed to do light duty while they were on workers' comp. So just so you know, and it's a matter of record, what we did before we made any decision to allow that is we consulted Jeff Beamer, the attorney that the county's used for labor issues, and emailed the question about that, got the response, and got guidance on how we should handle that. And we went the letter of exactly what he said. Because I'm not a work comp expert, you're not, or anybody in this room probably, there may be. But we just want to make sure that we do march that out, and we did allow that once we got guidance on that, so.
And the only thing I bring out about that is Mr. Beamer's allowed everybody that works for the EMS now to get the same thing,
Well,
same
what-
treatment.
here's what he said, and
Yeah,
I'll
now,
tell you exactly what he said, and this is how I pose it to him. In the past, you know what I'm talking about, it was abused.
Yeah.
There were people that, and y'all, I'll tell y'all this just for transparency, there were people that were off on work comp during Jackie's administration. I'm not bad-mouthing the man, he's dead. But they would be off and would get a full check. Well, the policy manual allows you to use 8 hours per shift of leave or come in and work 8 hours, because work comp's only like 60% or something like that. So to make up for your benefits and your loss in pay. Well, since those folks were abusing it, we just said, you know what, stop. We're not doing anything. Well, you know, speaking to Jeff, he said, you need to treat, if you've got something you can give somebody to do, you need to let them do it. So we don't always, but he said, if you got something, you got 2 hours of work, let them do 2 hours. If you got, X hours, let them do that. But he said, you need to treat everybody exactly the same. And if you've got something for them to do. Now, I think the city they'll allow their employees to go work in, maybe in a different department or something like that. Because we don't always have something that they can do. Somebody might have filing in a department, or they may have errand running or something like that. But in this case, we had some stuff to do, and I'd like to, accommodate anybody I can. And Jeff, he said that,
And here's the email exchange with him
On that note,
stating that we did that
I
by the
believe,
book.
you, sir.
But he said also, no matter what you did in the past, he said you need to do it right from now on, and this is the way it needs to be done. So,
And then, of course, since you brought it up about the phone conversation, Jeff Beamer, the mayor was in the meeting about we have an attorney for free to answer the same question. It does work for the laborer, so.
Well, that needs to be
And I
communicated
told you-
officially to us so that we can utilize
we're
that
using
resource.
And it's not just that's y'all's department, any department, because that would save us a few thousand
If
dollars.
we have that
Who's
resource,
our free attorney?
The insurance people, Becky Brock and them, that we get our insurance from, she said anytime we had a HR question that maybe our insurance might go to court with or something, they have attorneys that will advise us for us.
Yeah, that's the first I've heard of that in 8 years.
Yeah.
I have tried to wean everybody away from Jeff.
Well, and if that's the case, then please provide us that information and the contact information, and
You
we'll
know,
have an
I've got
issue.
some
we'll write
department
for
heads
you.
that just, they got a relationship with Jeff Bamer, and they just want to keep going that route. But
No, we're not.
at his,
set.
at his salary,
We're not set on that. We just, I mean, we want to save
There's
money.
a better
and
way
if
to
there's
do
a
it,
better way, yeah.
I'd like to do it. If it
But
saves
this
us money,
attorney
saves
is
us
through
money.
our work comp carrier,
Yeah.
the
And that's
insurance
where-
company that furnishes our workers' comp.
he does our insurance on the buildings and
Workman's
stuff
comp,
like that.
Yeah, yeah.
And
Yeah, well-
if I'm not mistaken, Beamer's where he came from.
Farrer and Bates, who does a lot of that, the work comp I've been dealing with lately. But they're related somehow to Jeff, it's just a different attorney.
Well,
But that is a way the mayor can get us to save a
The
few
work
$1,000 a
comp, the
year.
work comp with Jeff, I understand, but he's getting calls like anything by employees, if they just.
Right.
There's problems and stuff and.
We've used him before on sexual harassment,
Yeah.
things that we haven't encountered. Now we've encountered so many different things that we usually
Yeah,
don't have
and
to call
I
him.
can see where if we're going to go that route with Jeff, we can
Well-
hire an HR person.
Exactly.
Yeah,
And that's
he
money
is.
they could use for an HR
That's
person. If we figured
basically
it up for
$400
everybody.
hour per stiff.
Yeah, if we can get that information, we're happy to use it.
Okay.
And not just y'all, but I'd like to get it out to all the departments so they can all be on.
I agree.
Save the money, you know
Well,
what
I
I'm
can only help you on one department.
saying? And I appreciate it.
Yeah,
How
the
good
one,
these lawyers is, I don't know.
Well, and Clyde's helped me in the past too. I mean, I've called
Yeah.
Clyde about a lot of things before, and he's always gave me good advice.
Now can I call, was that everything you was gonna bring up? Me too for now? We can do next time? I'll just come to your next EMS meeting, committee meeting or whatever.
Fine.
I like to have a little break myself.
Bubba, you're welcome anytime.
I know you are. I know I am, sir, and I appreciate it. But, again, I want to commend the EMS on the job they do. I think they do a wonderful job for what the amount of people they got and what they cover and everything. But I just trying to figure out a way to save the county money. And when these questions are brought to me, I got to bring them to y'all. So.
You're doing what you're
And
supposed
believe
to.
me, y'all ain't the only department I got to come forward with. So I'm just doing them one at a time, sir.
I wanna make a comment and hope it gets in the record. But coming from private business for almost 40 years and dealing with a number of employees and workers' comp, I assure you that in Robertson County, every workers' comp claim in every department that's filed, the employee gets every benefit of every doubt, without question. So I don't think any of our employees have anything to complain about. Now, you did make a point that we need to treat everybody the same. I think that was the point you were getting at,
Everybody got to be
in a
treated the same.
roundabout way.
Yes, sir. That's my
And
point.
I think nobody would disagree with that.
Uh,
Any other business? Anybody online? Anybody that's here?
Stick with four again, man. I'm done.
There's one more thing I want to bring up, and it came from the Budget Committee the other day, and I want to direct it to you, Rick. And what they asked was, could we officially, now I know Dennis has already told us he made a phone call and talked to the group, but that's very different than talking to the actual government entity, the county entity, to see if you could compare our EMS operation, including budget, number of employees, number of ambulances, number of so forth, with a few of the other 95 counties that would maybe have an area similar to ours, maybe close to a metropolitan area like we are. I doubt if we'll find another county that has 2 interstates and 11 municipals, but we get as close as we can and get us some comparison. And then I'd like you to let me know when you get it. And then I'd also like to personally make a couple of phone calls or even make a couple of visits once we get down to the
Sure.
2 or 3.
Yeah,
You
sure.
do that?
Yeah, absolutely.
Okay.
One of the things that complicates that, and you guys know healthcare, and we have a county hospital in our county.
Yeah.
That's becoming less and less prevalent throughout, non-Medicaid expansion states, which we are one. So, there has been another closure, I think, in the last couple months. So one of the criteria to select and find a service like that is they have to have a county hospital in their county to be able to support from a
Right.
transfer standpoint, it's the same dynamics.
Sure.
Because otherwise, you're transporting out of county to some other hospital or, somewhere else or whatever. So just know that, that'll be one of the criteria I
Right.
use whenever I try to benchmark,
Perfect.
so to speak.
Yeah, and for the record, make no mistake about it, Northcrest Medical Center is a real economic driver for not only the region, but Robertson County. And I think the EMS committee is aware of that.
Right.
Okay, anything else?
Oh, let me rephrase it. Let me add the rest of my story. Told y'all I was in the hospital. Refused to go to Skyline. They found me a doctor and brought him to me. I was glad to do that. So they brought an
Northcrest did?
They found a Centennial doctor and brought him to me.
There you go.
So
That's home
that's
cooking, Bubba.
that's home cooking. But that wasn't the first idea.
You gonna be okay, Bubba?
I think so. Now I don't know. I go see the surgeon tomorrow, sir.
Any other comments?
Hopefully everything's good.
I love you,
Motion
Don.
to adjourn.
I've got a motion to adjourn. Do I hear a second?
Do I second?
Thank you. Thank you for the second. All in favor signify by wherever you are, standing up. We're adjourned.
Did you get?
I'm up.
I said I loved you, Don. You didn't answer. Reply back.